Imagine you are going to see your doctor and you being told that you have type 2 diabetes. The shocking part, the process may have started 10 to 15 years earlier, long before your blood sugar became abnormal, long before you notice any symptoms, and long before anyone warned you. Most people believe that diabetes starts when blood sugar rises, but that's not what the science shows. By the time your blood sugar becomes elevated, your body may have been struggling silently for years. Today, I will show you what happened first, why most people never see it coming, and the warning signs that appear long before diagnosis. In this video, you will learn what actually starts the type 2 diabetes process, why blood sugar is often one of the last things to change, the hidden problem many routine tests miss, 3 early warning signs that deserve attention. Most importantly, stay until the end because I will share a real clinical example that completely changed how one patient understood their health. I am Prasad, the consultant registered dietitian and diabetes care education specialist at Harper University Hospital here in Michigan. On this channel, I focus on nutrition science, clinical experience, and practical strategies that help you make informed decisions about your health. Let's begin. The biggest myth: most people think that type 2 diabetes starts with high blood sugar. That sounds logical. After all, diabetes is diagnosed using blood sugar test. But here is the important distinction. High blood sugar is usually a late sign of the problem, not the beginning. The real issue often starts with something called insulin resistance. Insulin is a hormone that helps move glucose from your bloodstream into your cells, where it can be used for energy. When cells become resistant to insulin, they stop responding as effectively. To compensate, your body produces more insulin, and this can continue for years. Your blood sugar may still look normal, but behind the scene, your body is working harder and harder to maintain control. But what causes the insulin resistance in the first place? To answer that, we need to look inside one of the most important organs involved in blood sugar regulation, your liver. And this is where the story gets more interesting. Think of your liver like a storage warehouse. At first, everything functions smoothly. There's space, there's organization, everything moves in and out efficiently. But over time, if more and more fat accumulates inside the liver, that warehouse becomes crowded. Shelves fill up, movement slow down, and eventually the systems becomes less efficient. Research has shown that excess liver fat is strongly associated with the insulin resistance and disruptions in glucose regulation. As liver fat increases, the liver becomes less responsive to insulin signals. One consequence is this: the liver can continue releasing glucose into the bloodstream even when it is not needed. This is one reason fasting blood sugar may begin to rise. But here's what many people don't realize: this process can develop gradually over many years. No symptoms, no warning alarms, no obvious signs, which is why so many people are surprised by a diagnosis. But the liver is not the only organ involved. Your muscles are the largest storage site for glucose. They act like giant sponges. When they are sensitive to insulin, they soak up glucose easily. But when they become resistant, that sponge becomes stiff. It doesn't absorb as well. So, your pancreas produces more insulin to force glucose into resistant muscle cells. This is another reason insulin level rises long before blood sugar changes. And again, you feel nothing, no symptoms, no warning signs. And this silent struggle continues until the system cannot keep up. Your pancreas is constantly monitoring your blood glucose level. When insulin resistance develops, it has to work harder. Imagine a factory that suddenly has to double the production just to keep up with the demand. At first, it manages, then it strains, then it tires. Over time, the pancreas cannot keep up with the increased workload. That's when blood sugar finally rises. And that's when diabetes is diagnosed. But the underlying process may have been happening for a decade or more. And this brings us to a real example. Once I worked with a patient whose blood sugar levels were still within the normal range. On paper, everything looked fine. But when we looked deeper, there were signs. Their body was already struggling. Their fasting insulin was elevated. Waist circumferences had increased. and they frequently felt tired after meals. Their blood sugar hadn't crossed the diagnostic threshold yet, but the underlying process had already begun. This is why understanding what's happening beneath the surface matters so much. And it is why waiting until blood sugar rises may mean missing years of opportunity for prevention. So, what does this mean for you? The good news is insulin resistance doesn't happen overnight because it develops gradually. There are opportunities to improve it. Understanding the process helps you focus on the root cause rather than simply reacting to elevated glucose numbers. Think about it this way. If a warning light appears on your car dashboard, you do not just cover the light. You investigate what's causing it. Blood sugar is often the warning light. Insulin resistance is part of the underlying problem. Addressing the factors that contribute to insulin resistance may help improve metabolic health. But before we discuss warning signs, let's talk about 3 common mistakes. Number 1. Focusing only on blood sugar numbers. Blood sugar is important, but it doesn't always tell the whole story. Number 2. Assuming diabetes develops suddenly. Most cases develop gradually over many years. Number 3. Many people feel completely normal during the early stages. So, what should you look for instead? Warning sign number 1. Increasing waist circumference. Excess abdominal fat is associated with the higher risk of insulin resistance. Warning number 2. Fatigue after meals. Some people notice energy crashes following carbohydrate-rich meals. Number 3. Rising fasting blood sugar over time. Even values considered normal may be worth monitoring if they are trending upward. These signs don't automatically mean someone has diabetes, but they can be signals to pay attention to and discuss with a healthcare professional. Key takeaways. If you remember only 3 things from this video, remember these. Type 2 diabetes often develops gradually over many years. Insulin resistance commonly begins before blood sugar becomes elevated. Early awareness creates opportunities for prevention and intervention. Now that you understand what may happen before blood sugar rises, the next question is, why do cells become resistant to insulin in the first place? That's exactly what I'm going to discuss in episode 2. If you found this helpful, subscribe to NutriFocus with RD Prasad for evidence-based nutrition and diabetes education grounded in science and clinical experience. Stay healthy, stay smart, and stay focused with NutriFocus. I am Prasad Veerasinghe, the consultant registered dietitian and diabetes care education specialist at Harper University Hospital here in Michigan. I will see you in the next episode.